I am addressing you today on the coronavirus COVID-19 pandemic that has destabilized economies and the social existence of many countries in the last 4 months. COVID-19 has finally found its way into our country, and reports reveal that there have been an increase in the number of confirmed cases. In Edo State, we have developed an action plan to cope with this pandemic. The postponed National Sports Festival Edo 2020 gave us the opportunity to put in place a contingency plan. We have 3 isolation centers in Benin City, Iroa, and Auchi, a federal government testing center in Iroa, and a large number of well-trained and certified health workers to treat and trace patients. Coronavirus is not a death sentence, so there is no need to panic. With swift identification and proper management and care, many persons who have been infected with the virus have made full recoveries. If we all work together and take the right precautions, it is possible to cope with this virus. As you are all aware, the common signs and symptoms of coronavirus infections include dry cough, fever, and difficulty in breathing. Since COVID-19 is a virus that is transmitted from one person to another through close contact, the most effective and proven remedy is to reduce its spread is through social distancing. Social distancing involves reducing as much as possible physical contacts with others. The government of Edo State, therefore, advises that from today, 23rd March 2020, every citizen should practice social distancing to prevent the coronavirus from spreading in our state. In order to give effect to our social distancing policy, gatherings of more than 50 people are prohibited in Edo State until further notice. All schools are to remain closed in Edo State until further notice. Public transportation will remain in operation. However, crowding in commercial vehicles should be avoided. All public officers below grade level 12, except those providing essential services such as fire and healthcare, should work from home until further notice. Citizens are advised to postpone unnecessary travels in and out of the state, and if possible, stay at home. If you know of anyone who arrived from Europe, the Americas, or Asia in the last 30 days, please give details of such persons, including their phone numbers, so that we can provide screening and any required support to them. You should call the following numbers: 0808 409 6723, 0806 425 8163, 0803 583 5529, 0807 413 2019. If you or any relative of yours has any signs and symptoms of coronavirus, please report to the nearest designated hospital. These are Central Hospital, Edo Specialist Hospital, and Stella Obasanjo Hospitals in Benin City, Iroa Specialist Teaching Hospital in Iroa, University of Benin Teaching Hospital, and Auchi General Hospital, so that these persons can be monitored, tested, and treated. The Edo State government is very interested in the health and welfare and social support for the very vulnerable in our society, particularly the elderly and persons with chronic diseases. If you know of any of these persons in this category who may be ill, kindly call and report to the numbers which I listed above. The Edo State Task Force on COVID-19, which is headed by me and made up of prominent leaders in the state, will meet frequently to review and update the situation. As you go about your daily activities, apply extra caution, such as washing your hands regularly with running water and use alcohol-based sanitizers. As we face this challenge, I call on all Edo residents to remain calm and cooperate with us and ensure that you follow the instructions and steps which we have outlined to curtail the spread of COVID-19. Be rest assured that your government will provide the required leadership and support to check this pandemic in Edo State. I thank you, and God bless the people of Edo State.